Hi, day 111. Hi, everybody. So, we spent about 7 hours in the hospital today, and it was a rather interesting day. It was a weird day because things were like, I don't know, were not smooth. Things didn't go smoothly, which is funny because as we were walking to to the CT imaging center, that's what Matthew and I were talking about is today we're going to have, I hope it goes really smoothly. And that was like a little jinx because it didn't. Uh, anyway, I'm glad that we're home from today. And Matthew is going to tell you what the doctor said because he has a far better memory than I have and much more objective. Objective? Objective. Subjective.
I was observing for sure. Yeah, so Dr. Hendefar today said that the response that Donna has shown to the treatment is quite extraordinary, and they don't see that all the time or a lot. So her scan today, again, was very good and showed continued recession of the tumor to the point where he said that you couldn't even really describe it as a tumor anymore because it had broken up so much and was more dispersed in the tail of her pancreas. So obviously he was very happy with those results, and he said it's not something that they see all the time, and so that was really good news. And he thought that after the 6 months of chemotherapy that we could take a break, Donna could take a break and see how it goes. And it's more of an art than a science, cancer and cancer treatment. But he felt that it was going well enough that after this initial 12 rounds, we could step back and see how it goes. And no guarantees, but it's obviously going very, very well. So
Yay.
that was great news to hear. And because Dr. Hendefar, we just found out, was named one of the top 10 pancreatic specialists in the country, along with others from Sloan Kettering and other places. But he does a lot of research and he's just very insightful. And he just says, you just never know, that every case is different and unique to itself. But we've done all the genetic testing and genomic testing, and Donna's particular type of pancreatic cancer is one that doesn't mutate very often. So he says, if it continues to recede and go away, that it may not come back, or it might, but it might take a long time. But it's not something that he thinks, based on the progress so far, that Donna's going to need to continue to do chemo every 2 weeks, forever. And so we'll wait and see. And we talked about the Care Oncology repurposed drugs that Donna's taking and whether that might be helping. And there's no guarantee or way to confirm that of 100%, but it's certainly not hurting.
He says whatever I'm taking, all the things that we're doing is working, and that was very optimistic. And
yeah.
And he was very happy. So to have a doctor smiling and through his mask, but and saying these wonderful things that I like I said really like to hear, of course. I just that's how the day ended. So it was it ended on a very positive note.
Yeah, they didn't allow me to go into the CAT scan to the Mark Taper imaging center due to COVID reasons or whatever. So Donna was texting me because it was like a Keystone Cop thing in there. The first nurse
yeah.
couldn't work her report, and then
Like you
This,
can't even see. It's so raw.
and the second, it was just one thing after another. They didn't know her case. They
Yeah.
didn't know anything about her. They weren't sure what they were doing.
It was weird. And
It was,
she the first nurse, I'm obviously she was new or something. And she freaking, I have never had somebody like put, get the needle in the port and then, oh, it didn't work. I'm like, it didn't work. I've had like, I don't know, 40 whatever port injection things. It didn't work. That was just kind of weird. And then, so I had to wait for another nurse, like a nurse that was there for 25 years because I asked her, how long you been doing this?
so Donna's texting me. They're taking me to another part of the hospital. I don't know what's going on. Nobody seems to
It
know
was
what's going
crazy.
on. So,
Oh, and then
yeah.
they didn't have the right size. The new nurse didn't even have the right size needle to stick in the port. She goes, "This is too long," and da 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 da. But I'm gonna have to use it because we can't find any others. And I'm like, can't find any others. Weird. Couldn't find any the sterile gloves that go with the. It was just weird.
Yeah.
It was just weird. It's a weird day. But
So Donna was texting me and telling me
I'm
about
like,
what was
help
going
me.
on while I was waiting down the street, to come back. And at one point I texted her, the day can only go up from here.
And it did.
And it did. So that was good.
Ay, ay, ay.
Yeah, but we talked about, Dr. Hennifer thought that Donna was doing so well that maybe, whereas she wasn't initially a candidate for surgery, maybe she could be a candidate for surgery. But then we talked about it, and we really wanted to avoid surgery if we could. And he agreed that
I'm really not.
since it's working so well the way we're going, let's just keep on that path and just see how it goes. But he did say that it's not typical to have the type of sort of immediate and comprehensive response that Donna is showing. So.
Yeah, he thought my markers were kind of extraordinary. It's like, you're 4, 4.5, what?
Yeah.
So that was pretty cool.
And the cachexia trial with the ibuprofen.
Yeah.
And the fish oil.
And I mentioned my heating pad that I had told you all about that I've been doing since day one. And he's like, don't change anything.
We talked about some of the therapies, the insulin treatment therapy we've heard about in Germany and this and that. And, we just talked about, we just threw everything out there on the table. Like, what should we keep doing or not doing? And he was very, very open. And he's one of the leading experts in his field. And he was really open with us and transparent, and it was really nice. And he walked us through the CAT scan, and he showed us like the first one versus this one, and how you can't even hardly see it anymore on the scan. So it's,
just gonna keep on doing what we're doing. Yes. So we wanted to share. I wanted Matthew here so he's far more, he can give you the information. I get into stories. You already had a story yesterday, so today was more informative. And we're going to keep it short and sweet. And it was very positive. We're not going to know all the results from the CT scan because that is the radiologist's. That's his duty. That's what he does. And it usually takes about a week. So I will tell you when I know, because I can't wait just for him to say, what tumor? Yeah, and the one in the pancreas, it's like 1 centimeter. No, we'll see. That's what we're hoping for.
Yeah. And we confirmed with Dr. Hannafar that the genetic testing showed there was absolutely 0 genetic links to any of this. So, it was interesting because he was talking about a lot of the research and a lot of the trials he's done and a lot of the things he's been exploring and researching. And he said so much has happened just in the last 2 years.
Right.
With regard to their breakthroughs, and understanding of this disease.
Right.
And why it happens, or who knows why. And, he says in younger people, there typically is some sort of genetic trait that triggers it early. But he says as you age, sometimes cells just mutate and there's no reason for it at all. Like you're not necessarily exposed to anything either. It's just, he says, it's part of the aging process. A lot of the people who get pancreatic cancer are older as they age. It just sometimes, for no reason whatsoever, genes can mutate, and some genes have a more of a propensity to do so than others. So they're really doing a lot of research in that area and breaking through. But he doesn't think that Donna was exposed to anything as a youth, and there's no genetic link. Um, the genomic testing, which is different than the genetic testing, the genomic testing is the test of the actual cancer cells. He says, he looked at Donna's and part of them, are slow mutating. They don't mutate very fast. So if it goes away, it might not come back very quickly. But he said there was one cancer gene in there that was very rare.
I have a rare cancer gene.
Yeah, and
That
don't
was
know
kind
what
of
that
interesting.
means. But
He had no idea. They can't even label it.
Yeah, so who knows? Maybe it's just a fluke. They haven't really seen it before.
Right, and the whole looking into and really, really, really working on pancreatic cancer is fairly new. He said only in the past 4 years that they've really, really, spent a lot of quality time trying to figure out pancreatic cancer, tail versus the middle versus the head versus metastatic versus it's new. This is not, they've been working on the other cancers for a lot longer. This one is.
Yeah. And they don't know why.
They don't understand it at all. They don't know
why some people respond better than others.
So.
But
I have a rare one. Hey, I have a rare cancer gene. Who knows? Maybe that's going to turn me into like Superwoman or something.
Right. Like Spider-Man. I don't know.
Superpowers, yeah.
Yeah.
All right.
But it was really...
That's it? Yeah.
It was all good.
It's all good. So glad to be sharing with you. We love you guys so much.
We do believe that the power of...
totally.
Energy, thought, prayer, all of it. We believe that makes a difference.
Yep.
And in this case.
Yeah. Yeah. For sure. And positivity and yay.
Meditate, all of it. We think everything makes a difference.
So we thank you.
Yes.
Yay.
Very much so.
All right. On that note, we're signing off. Because it also means a good night's sleep. Okay. Mwah and mwah. Love you. Love you right there. Doot, doot, doot. Love me. Talk to you tomorrow. Bye.